All right, good afternoon, everyone. It is Wednesday, April 3rd, 2024. It is 3:03 p.m. I'm going to call the meeting of the Housing and Economic Development Committee to order. I just want to make note that if we do have, which we've been experiencing today, some temporary power disruptions, we will need to call for a short recess and then resume once the equipment comes back up online. So just giving that in advance. Also, some changes to the agenda. There was, under Chair's report, Tompkins County Living Wage ID number 12327. That will be postponed for a few more meetings. We'll let folks know when that gets rescheduled, whenever that might be. There was some technical difficulties with the presenters being able to join the meeting remotely today. And then also, if without objection, I would like to move, because Nick Hemholt from our Department of Planning and Sustainability is joining from his vacation somewhere. I would like to move the arts, culture, and tourism items up under advisory board appointments. And then we will also take the resolution for authorizing a partnership agreement with Point Broadband as well at that time. So if that works for everyone without objection, I would go ahead and make those changes. We do have a few public comments today. Just to remind folks, the rules for speaking under privilege of the floor. You agree to a 3-minute time limit, agree to not raise your voice, not use lewd, obscene, profane, slanderous, or libel language, or speak or act in a manner that would tend to incite a breach of the peace. You agree to not speak about county personnel matters. Personnel matters include comments about the job performance of named county employees other than elected officials. After 3 minutes, you agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. Agree to be courteous and not make comments, gestures, outbursts, or disruptions while other members of the public or the legislature are speaking. And you agree in the case of a disruption that you may be asked to leave the chambers. The two folks on our speakers list, I have no doubt, are going to be more than well behaved and appreciate you coming to join us. The first person we have from the city of Ithaca, Teresa Alt. If you want to make your way to one of the microphones, Teresa.
Hello, I'm Teresa Alt, Eddy Street, City of Ithaca. And I really just wanted to cheer you on that you are taking up working on the problem of homelessness, needs work, and perhaps, well, I also wanted to cheer you on taking up also wanted to cheer you on taking up the living wage topic, but I hear that that's been postponed. So look forward to hearing about that another time. Thank you.
Thank you for joining us, as always, Teresa. Next, we have Bob Lynch from the town of Enfield. Sorry, Robert Lynch is what it is.
Right, and from the town of Enfield. Good afternoon. Robert Lynch, councilperson, town of Enfield, and I'm here, I guess, speaking for the Enfield town because we thank you very much, by the way, for taking up this partnership with Point Broadband for filling in the gaps of broadband service, of which we have several in Enfield and other towns have a whole lot more. So we appreciate what you're doing. We support this resolution. I do have a couple of questions about it, and one is unfinished business from past meetings, because when ECC Technologies presented the broadband study to us at the last opportunity, there were places where in Enfield where I believe there wasn't service, the ECC didn't seem to notice, and there were also places in Enfield, like my own road, which ECC said there was no service, and there is plenty of service by Haithely Connect. So please look into that a little carefully so that you know exactly where cable has to be strung. The second question I have is kind of the ambiguous nature of the resolution in one part, and this is down at line 31. Whereas Point Broadband has indicated that they will establish subcontractual agreements with incumbent internet service providers to expand broadband service to unserved locations in the town of Ulysses and Enfield. And those are areas that they would subcontract to somebody else. They don't say who the somebody else is. And I know that in Enfield, we're served by Haefely Connect, very good service provider. They do well. I know that portions of Ulysses are served by Charter Spectrum. And as anybody has heard in public meetings over the past several years, especially from Jason Leifer in Dryden, there are problems with Charter Spectrum. So if Point Broadband is contracting with a subcontractor, a service provider, I hope that it will be Haefely in this case and not Charter Spectrum. And that's my only request, and I hope that the county will have oversight of those subcontractual arrangements so that we make sure we get good service. I thank you.
Thank you. I saw that folks from our Planning and Sustainability Department taking notes and nodding their head during those comments. So we'll make note of that for sure, and hopefully we can follow up and get some of those questions answered when it's time for that on the agenda. We have advisory, let's do this, sorry. I'm all over the place today, I apologize. We're gonna take the minutes from March 6th. If someone would like to move those, Ann Corman, seconded by Veronica Pillar. Any changes to those minutes? All right, seeing none, since we're all here in person, now we can do a show of hands, all in favor? All right, that passes unanimously. Advisory board appointments, ID 12249, that has been withdrawn from the agenda by the individual. So we will look to the county administrator's report.
Thank you. I don't have one today.
Okay. Great. So then, Nick, if we want to, let's take the arts, culture, and tourism items just real quick. And so we have resolution award of spring 2024 tourism advancement grants, ID 12313. I'll go ahead and move those. If I could have a second, please. Seconded by Ann Corman. Nick, if you are able to and want to jump in to highlight anything for the tourism advancement grants, that'd be great.
Sure. Thanks, everyone, and thank you for being flexible with the agenda ordering here. Yeah, tourism advancement grants. This is our spring round of grants intended to draw in visitors for overnight and day trips to Tompkins County. We had a strong interest in this grant program this spring. Had substantially more requests for grants than we had budgeted funds for. You'll see in the packet there is a list of all of the recommendations that were endorsed by the Strategic Tourism Planning Board at their March meeting. So happy to answer questions folks have about any one or the general process.
Any questions on the tourism advancement grant resolution? Just so folks are following along, this is packet page 92. All right, seeing none, if we're ready to vote, go ahead and all those in favor? All those opposed?
I'm not opposed.
All those abstaining? We have one abstention. And Mike, just for the record, the abstention is the possibility of marketing dollars being spent with your employer.
Yes, the Puppet Festival, I think.
Okay, great. So abstention noted.
I have no idea, but yes, I don't know yet.
The next one, we have resolution award of spring 2024 community celebration grant, ID 12314. I'll move those, seconded by Veronica Pillar. Nick?
Similar theme to the last grant, the community celebrations grant had a really strong interest this spring. Lots of folks applying, lots more funds requested than we had budgeted for this cycle of grants. So definitely had some more difficult choices to make in terms of how to divide up the funds there. 28 applications, and I believe we're recommending 23 of them for awards here. You'll see several events in this list that are returning events that have been in the community for many years, and several that are new. So it's a good mix, I think, of applications and programs here. The difference with the community celebrations grants is these are not required to generate tourism from outside the county. These are really, not aimed at that objective directly. So they are required to be free and open to the public, and generally are intended by folks, locals, and sometimes we have visitors come as well. So happy to answer questions folks have about community celebrations grants, either individually or about the process in general.
I just want to point out, it's nice to see Danby, Trumansburg, Newfield, Dryden, City and Town of Ithaca, Lansing, Enfield, Newfield, Caroline. It seems like a nice representation across the county. So thanks to those that participated in that grant review process. Any questions by members of the committee? Veronica?
This looks like a great spread. Just because it caught my eye, in one that didn't get funding was something at Cinemapolis, reproductive rights celebrating Tompkins County and Connie Cook. And one of the comments is committee raised concerns about how free and open to the public this event actually is. Can you expound on that? Because that free seems like it should be pretty cut and dry.
That was related to giving tickets, I believe, to a showing to a group of students. So it'd be just like a portion of the attendance would be free, but the other attendance would be paid. I think that was the confusion around that element.
That makes sense. Thank you.
Seeing no other questions, if there's no objection, we'll go ahead and call for a vote. All those in favor? We have 4 in favor. All those opposed?
Abstain?
1 abstention. Mike Ziegler for the same reasons as the previous resolution. The next resolution, we have the award of 2024 Tompkins Outdoor Grants, ID 12315. I'll go ahead and move those if I could have a second. Seconded by Veronica Pillar. Nick, any highlights here?
Sure. This is the 3rd year we have run the Tompkins Outdoor Grant Program. This is intended to support capacity building for our nonprofit organizations that are focused on outdoor recreation. We only had 3 applicants this cycle, so we did not end up awarding the full amount that we had budgeted for in this grant program. However, those 3 applicants, I think, brought some really great programs and ideas, and you can read a bit about what they're planning to do in the pages there attached in the packet. Happy to answer questions about this program or the proposed awards.
Any questions by members of the committee? All right, seeing none, all those in favor? That's 4 in favor. Any opposed? None opposed. Any abstentions?
I'll abstain, but I don't think I have to on this one, but I will.
Okay. Mike, out of an abundance of caution, is going to abstain for the same reasons. All right, so that crosses off our arts, culture, and tourism section. And then, Nick, the next one we have, which I know many of us are very excited about and know that a lot of work went into this by a lot of different people. And I'll ask Katie Borgala also to come join us at the table here. But I'm going to go ahead and move the resolution authorizing a partnership agreement with Point Broadband to expand high-speed internet service to unserved addresses in Tompkins County in the towns of Groton, Lansing, Ithaca, Danby, Newfield, Enfield, and Ulysses. ID number 12319. I'll go ahead and move that. If I could have a second. Seconded by Ann Corman. Nick, I will turn it over to you. I know that we are joined by Chuck Bartosh from Point Broadband, and also we've got Mark from ECC Technologies joining us as well remotely. So Nick or Katie, I'll turn it over to you to introduce the resolution, please.
Yeah, I'll just give a quick introduction. This is the culmination of almost 2 years of work on our staff's part. Nick did the bulk of the work for us. Lauren Cottrell from ITS was also involved, as was Bridget Nugent, and some leadership amongst legislators, as well as Kurt Anderson from IAED, our economic development entity. So I think this is a great solution myself. I'm excited to present it to you, and Nick did a nice job laying out his memo, so I will turn it over to him to walk you through the memo, and then we can try to answer any questions.
Thanks, Katie. I'll also say I intended to wear a collared shirt for today, but I just walked back through like a rainstorm, so this is the last dry shirt I have. So,
Can we just wait a few minutes for that? Or is that okay?
It's in the dryer.
It's all good, Nick.
So, all right. So without any further ado, yeah, thanks Katie and Greg for the introduction there. Just rewinding a little bit, Tompkins County partnered with ECC Technologies in 2022 as a part of our attempt to really figure out how to expand broadband service to the unserved locations within the county. And they've been instrumental in helping us with that. And Mark, I'm sure will get a chance to share some of the insights we've had along the way here. The big step that this memo and this resolution addresses is regarding the request for proposals that the county issued last fall. It was issued in September of 2023. The bids came in October. We received 7 bids. And these were proposals from a variety of for-profit firms and municipalities to figure out how to expand broadband within portions of the county. And so we really had a variety of different solutions that we were exploring with this review. So there, which led us to issue a series of questions back to the bidders late fall to get some clarifications, and then schedule interviews with some of the bidders in the winter of early 2024. As such, we found that the initial sort of cost-based analysis showed that a combination of bids from Charter Spectrum and Point Broadband would be sort of the most cost-effective way to provide coverage to the entire county. So there were follow-up interviews held with those 2 firms. I should also point out that throughout this process, the approach to funding that the state has been describing for broadband expansion has been laid out in draft forms and in some cases implemented. The most relevant portion of that is what's called the Municipal Infrastructure Program. And this is a program that's run by the New York State Connect All office and is aimed at municipal broadband systems similar to what Dryden is building with the Dryden Fiber Project. We understand that the towns of Dryden and Caroline applied for funding under this program, and because of that, encouraged our legislative leadership to support that through a letter of support, which happened earlier this year. And as such, we think that the best possible option for funding for expanding infrastructure in those areas right now is the Municipal Infrastructure Program, which is why they have not been included. Those 2 towns have not been included in this resolution for a partnership agreement at this time. That said, the other 7 towns in the county that are all listed in the title of the resolution are where we know there are approximately 600 addresses that are unserved by cable or fiber and really lack access to reliable high-speed internet. Even if they wanted to pay for it, it would be either expensive or high speed or low speed. So we, in an attempt to sort of close the digital divide, are proposing a partnership here with Point Broadband. And I think I'd echo Katie's statement earlier that this is something that we're excited to bring to the legislature here because this feels like it's a partnership that has a lot of potential and promise to help a lot of folks throughout the county. I'll also say in response to Mr. Lynch, your question earlier regarding the resolution, we do have the firms, subcontractual agreement firms identified as of our last conversation. Those were Hayfley Connect and OTTC, which may be going by a different name, and Mark or someone else can jump in and correct that. Those are the two firms that we're looking at for the towns of Enfield and Ulysses for partnerships, subcontract agreements. You'll see in the memo and in the resolution as well, sort of the conditions of this partnership that are described and how this would move forward. If it goes forward as proposed, it's possible that the county won't have to put in any additional funding for a local match for the BEAD program, which is the Broadband Equity Access and Deployment program. This is the large pot of money that the state received for expanding broadband throughout the state. That said, that's still unknown. There's still a lot of parameters and decisions that have to be sorted out, but we're optimistic that this represents the best value and direction for the county to move forward with, to expand broadband access to those locations in the county that currently lack it. So with that all said, I'll pause here and open it up to any questions from the committee.
Nick, before we open it up, can you just touch on the budget implications or the financial piece that's outlined, I think, in your memo and also in the resolution?
Yes, thank you. Yeah. So one of the conditions of this partnership agreement would be that the county funds a preliminary engineering study that would be conducted by Point Broadband. It's throughout the county, the 7 towns, that is. We would authorize up to $100,000 in contingent funding to be available to conduct that study. So if there's a possibility for us to recoup that funding from the state, we'll seek it, and we'll instruct Point Broadband to work with us on that. But right now, that's unclear whether that possibility will exist.
Katie?
I just wanted to share one other thing that we've had a couple of conversations with the Connect All office in Albany, the ones who are tasked with running the BEAD program for New York State. And they're really excited by the process that we followed and very thankful to Tompkins County for engaging ECC and doing the staff work required to figure out how many addresses we have unserved and issue an RFP, go through, have the interviews. So they're really pleased with this work, which indicates that we probably have a strong chance for a good application and good amount of funding. So that's another reason that Nick and I are excited to bring this to you. And again, thanks to Mark and ECC, his team.
Yeah, having had the opportunity, and some days it felt like a pleasure, other days it felt like a lot, that committee, but it was a lot of work, a lot of information that some of us really didn't understand very well, but tried to get up to speed as quickly as possible. And I know that this kind of feels like the culmination, but really it's sort of also just the beginning of the process. So I would say the first stage, we've done a great job, and really, I think a strong commitment from those involved to make sure that underserved and unserved addresses are connected in the best way possible. So I'll open it up to other members of the committee for comments and questions. Mike Ziegler.
I just had 2 questions. So it sounds like we're down to 600 residences now. So has the estimate on cost gone down by half as well? Is that about?
That's the 600 that are missing are the ones that are in Dryden, Carolina.
Okay. So we did go from like 1,200 to 600 though? Because we were looking at it. Oh, go ahead.
Right. So of the 1,200 throughout the county, there's roughly 600 in Caroline and Dryden, and roughly 600 in the balance of the county.
Gotcha. So has the county cost estimate gone down quite a bit then? Has it been halved or not quite as much, that much? We were looking at like $7 million estimate, if I remember it.
Oh, right. Yeah, the $7 million was assuming we would be doing the entire county, including Caroline and Dryden. So that's a good question. I'd need to crack open a spreadsheet, which somebody might have a quicker way to do for me to answer that question.
Okay. And the other question is, this study.
Hold on one second. Mark?
Sorry, yeah, if I could just, just to recap here again, with getting, sorry, my name is Mark Meyerhofer, ECC Technologies. But just to recap here in terms of the bids we received, that the county received through the process. And again, it wasn't all bidders bidding on all the 9 towns. So the combined total project cost originally, including Dryden and Caroline, was nearly $14 million. So again, taking that into account, it is approximately half, and that's where part of the field engineering will finalize that number, if you will, the total project costs once, you know, if the county were to move forward with this agreement.
Chuck from Point Broadband?
Does this work? Oh, it does work. Okay, great. So the answer really is it's probably about 30% less. The reason is Dryden is much more compact, and so is Caroline, in fact, for where it's served. So it's fewer route miles to serve that half that are being excluded. So that's the first thing. The second thing is, from a county perspective, you're not putting in money either way, even if it was the original 1,200 or if it's the 600, because all the funding will either come from Point Broadband or the state BEAD office. Hope that helps. Before I go, if you want, I can answer a little bit about OTC. I can wait, just tell me. Or, I'm sorry, okay. You had asked about Enfield and Ulysses. In neither, Hapley did not apply. I assumed when we applied originally that Hapley would. He didn't apply for the project in Enfield. So we have to put together a project that says we'll serve it. But I did talk to Lee, who's the CEO, and he's willing to let us subcontract out to him. There's no formal agreement yet, but my philosophy when I talked to Lee was it's going to be cheaper for you to serve these households than for me. I can do it, but then I'm overbuilding you, and I've got no interest in doing that. And the same thing happened in Ulysses for the few households. We've got a plan put together where we can do it, but we've got no interest in doing it because if OTTC will do it, they can do it. So it's an informal thing at the moment. It wouldn't be appropriate, I don't believe, to be in the resolution specifying who it is, but I can guarantee you it's not Spectrum. So hope that helps.
Yeah, well, you heard it here first, folks. Mike, sorry, one more question. You had a second question.
I'm sorry,
do,
do we
and
want
then
to just say Chuck's full name for the record?
Oh, I'm sorry, Charles Bartosh.
This $100,000 study, what will that encompass?
Go ahead, please.
All right, so it's what's called a walkout engineering. Normally when you do a project, you do a desktop engineering that says what are the routes going to be. You make guesses as to what's going to be underground and aerial. Aerial's usually cheaper unless you've got to replace telephone poles, for example, in which case it could be far more expensive. So when we designed the proposal, we assumed 75% was underground, 25% was aerial, which I believe is definitely an overestimate. But the only way you really know that is by essentially paying somebody to go out and walk the miles. And there's two things that happen with that. One is you look at the telephone poles to decide what has to be replaced, where there's sufficient clearance and room for you to be on it, and where there's not. Where there's not, you're going to have to be underground. And sometimes the routes that a desktop engineering identifies aren't possible routes. There might be a ravine. Believe it or not, there's ravines here. You know, there's lots of reasons why you have to change it, and the only way you can do that is by doing a walkout. The advantage we have by doing this now is oftentimes what happens is people will do a desktop engineering thing only and then submit for a grant, but then you don't really know if you're accurate or not. And the advantage we have, and the state knows this, is we will know exactly what the costs are, within reason at least. And that will give us a serious leg up, because that's the state's biggest problem, is people make an estimate, they apply for funding, and then it's not sufficient. And then something happens. Oftentimes the project gets canceled halfway through. So that's the thing we're trying to avoid. It's also, by the way, it's also the kind of thing that no private company is going to fund before a grant exists, which is why it's coming from the county here. But everything else will be coming from us or the state.
I would just follow up on that. The return on our investment in that, right, the benefit we'll see from that $100,000 will far exceed the actual cost. So I think money well spent for sure. Veronica?
Yeah, I had I guess, comment and a question. One, congratulations to Point and to our Planning and Sustainability Department and everyone else. I'm excited that we're going to succeed in our goal without costing the county directly a lot of money. And I'm excited that we all are supporting the Dryden Fiber project and getting as much, it sounds like, municipal-owned network in as feasible right now. Also, I know that none of my constituents are going to cry about one of the companies that was almost involved not being involved. My question is about the resolution and the memo. The resolution refers to the memo for the conditions of the partnership agreement and mentions some, and then the memo refers back to the resolution for the conditions. Can we see like a copy of the partnership agreement before, not necessarily before voting this out of committee, but before approving it in the full legislature? Or is the agreement really just a paragraph long and talking about the Point providing a minimum of 25% of the costs of build out and the $100,000 thing? Basically, the path to detail seemed like a circle.
That's a good observation, and thanks for calling that out. I think we can share the bullet points that I think probably were in the memo and maybe got condensed at some point for a space, and we'll share that. We can share that either following this meeting, or if I can dig it out, I can send it in the chat or something.
Yeah, Nick, I would just say maybe assuming that this passes out of committee, if that's just something that we could share, or maybe Lisa could share with the full legislature in advance or anticipation of this being on the next legislature agenda in whatever form. Would that satisfy the request?
That would be great, yeah. And I don't think this Zoom meeting has a chat, actually. If it does, we can't see it anyway.
Correct, no chat.
Okay.
Katie?
And I don't think I have a copy saved on my thumb drive anyway, so I'd have to dig it out of my, I don't even know where, VPN, I guess, but.
I just want everyone to understand that this would be kind of the intended points to be included in the partnership agreement, but then we would negotiate with Point Broadband and make sure that it's all hammered out with ECC's help to make sure it's all in agreement. But those general points is what would be shared with the legislature.
Yes, yeah, perfect.
Great.
I have Ann Corman, and then Mike, I'll get back to you in just 1 second.
Yeah, thank you. I'm also glad to see the project getting to this point, we could say, and pun intended. So one question I have is, we had talked before, I believe, in this type of forum regarding not just underserved households, but filling in streets and roads because of potential residences could be built or housing complexes. So is that going to be addressed in this engineering study?
It can be if I'm told about it before we apply, before the end of June. Make sure I know about anything that might be in the plans, because there's no way to do it unless I know where it is. Same thing, by the way, with you, if you've got any residents that you know are not in the study but don't have service, let me know what those are ASAP. We did take care of the areas that are covered by Haefely already and got them removed from the project, so.
I think what we were talking about was just,
I know,
you know,
yeah.
It goes down a street, but there's a quarter mile, especially like in rural areas.
We wound up in the RFP really talking about unserved addresses and recognizing that a lot of the areas between the unserved addresses might have future homes and they would be set. But it just expanded the scope of the study so dramatically if you add in all the roads in Connecticut Hill and, you know, all of the places that are currently unserved. That just, the BEAD program's not going to fund that, number one, and I guess that's that's all of the points. Number 1, 2, and 3 is the BEAD program's not going to fund something
Yeah, if there's
like
not the money there.
that.
Okay, thank you. But
But-
you said if there's planned development or something.
Yeah, but there also is some, if you know of areas like this, there are ways to put, there's some flexibility in how we apply for the grant. They're not going to let us go down every road, but we can do what's called 12 kind of extensions, meaning we can go far enough so that if we only have to go a mile to get everybody else, we can do something that's pretty inexpensive because it's less than 12 houses. So if you've got thoughts on this, get it to me and we'll try to incorporate whatever we can.
I think this gets to Greg's point that this shouldn't be a celebration quite yet, that the real work is just about to start again.
Right.
And is it true to say that with some of the infrastructure that would be going into places, there's possibility, right, not a guarantee, but the ability to tap in or to access in some of these areas if, you know, if we're going by a road or something like that in the future, there's greater connectivity being created?
But yeah, as long as we're passing, we will always be able to serve. So there's no additional build needed. If we're down a road, it's going to be serviceable, so.
Great.
Because we designed for 110%. We basically pre-designed for extra households, let's put it that way.
Great. Mike Sigler.
My question is just because I've gotten this question from a number of people. What is the advantage of this system that we're pursuing, which I support, obviously. I mean, Nick has done a great job with this. What is the advantage of this system over, like, say, we go and we just buy this 600 people Starlink gear and subsidize their Starlink? What would be what is the advantage of our system here?
Okay, all right, so she missed the question anyway, so I will answer. The first thing is Starlink's pretty limited in terms of what it can do. There have already been areas in New York State, upstate New York, I mean, where they quit serving households because they're out of capacity. But more importantly, if you look at 4 years ago, the maximum speeds that people were getting really excited about was 100 megs by 100 megs.
Right.
Now, over half of our customers get a gig by a gig. And that's not even possible with Starlink. And we're already putting in place 2 gig service and 5 gig service, meaning Starlink's very quickly going to become outdated and not capable. The other thing is everything we do is symmetric, which is important. You know, if all you're doing is watching videos, all you need is download. Mm-hmm. But if you're going to be doing, you know, remote learning or remote medicine or conference calls or anything that almost all new services that come down the line are symmetric services. Even something that may yet happen, virtual reality, is something that requires an equal upload and download. Gaming typically does. So the advantage is basically all services, new services require symmetric speeds. This is a symmetric system, same up and down kind of thing. And it's highly extensible. We actually already have plans in for going up to 40 gig by 40 gig service, which probably won't be needed for 5 or 10 years, but it will be needed at some point.
And this further is just an investment in our infrastructure throughout the county to be able to expand when needed. So we're not adding, you know, a 700th, you know, satellite uplink sort of type of system, which still may work for some folks in certain parts of our communities. We have to acknowledge that may be, but for the most part, we're going to do our best to get to them. Any other questions? Are we ready? If there's no other questions, I guess we are ready to vote. So you all answered my second question. All those in favor? All right, that passes unanimously. Taylor, I guess I would ask that we put this under, take this off the consent agenda and put it under, because I'm sure there's going to be questions, and I would just ask, you know, Katie, or if you could just direct those involved to maybe be present or available for the next legislature meeting, that would be beneficial. Yeah. So, Mike?
Guys, what kind of timeline are we looking at then, if this passes and then?
Yeah, I think,
We were looking at, oh, go ahead.
oh, yeah, go ahead, Nick. I didn't see you there.
Yeah, no, sorry, it's hard to see who's making the body language to talk. Yeah, no, we're, I think 2 to 3 months for the engineering study. And then we expect to have applications opening up for the BEAD program, I think late this year and fall, possibly early winter 2024. So Mark, does that all sound about? Yeah.
Cool.
Yep, that's right.
All right, well, great. Katie?
Can I just add one more thing on the timeline? That's another reason we're excited to bring this to you, is I think with this pre-engineering study, it'll put us in great shape to get some of this money that is going to be, competitive, and it'll get us at the front of the queue so we can serve our residents.
Yeah, smart, thank you.
Great. All right, well, we'll move on to our next item, which I'm sure will be as robust of a discussion. We have, under homelessness and housing, and I know we have a number of people here. We've got Kit Kephart and Dina Bodnar. I just want to make sure I got the last name correctly. I see Liddy Barger and Simone Gatson. This is an engaged conversation. I'm going to turn it over to Lisa and Kit, predominantly Lisa, to kick off the conversation, but feel free, anyone can participate and engage. That's the hope of this. The first conversation we want to kick off is this concept around Code Blue 365. Haven't figured out a better name, but exploring the possibilities of extending our current structure or some form of our current structure through the summer months or the non-winter months. And then the next piece of the discussion, which we'll kind of have a break and then we'll pick up, is the preliminary report on homeless response system data that I know Katie and her team have been working on. So with that said, Lisa?
Thank you, Greg. So to kick off this first part of the discussion on the Code Blue 365, to start us off here, just to make sure everyone's aware, during the Code Blue season in New York State, when the temperatures are below freezing, local social service districts can and must offer shelter for people asking for it, and it's the closest equivalent we have to offering and running a low-barrier shelter approach for those 6 months of the year. For this current Code Blue season, 2023-2024, the county submitted a plan to New York State, OTDA, with an estimate of the cost for providing Code Blue shelter from November through April, approximately 6 months. And that total cost is $1.8 million approximately, for which we will receive New York State reimbursement to offer those services. So this is our starting point for a cost estimate. We believe that if we were to continue this low barrier approach in this similar fashion for another 6 months of the year, the cost would be approximately $1.8 million to the county. The only difference is we wouldn't be reimbursed for it, it would be a local expense. And this would be the full stop low barrier sheltering approach. You could see this as kind of one end of a spectrum. There are some concerns about trying to make this full-blown approach happen all at once. One is the cost. We don't have a budget for it in 2024, and it's a high cost. But a second important concern is the current system capacity to operate this, staffing, infrastructure, security concerns. We're already seeing that our shelter system is at capacity, and there are some concerns to be able to maintain this current effort 365 days a year and do it safely and successfully. But there may be other approaches that we could take to address this current an urgent need to shelter individuals currently living in the encampments and elsewhere and achieve some impacts. And we've been just starting to have these conversations about what we could do. An approach being taken in other areas of the country with some success, and something that we could look at here, is the county working in direct coordination with the city to make an effort to relocate individuals living in the unsanctioned areas and prioritize sheltering to any of those individuals who are being told to vacate the city-owned encampment areas. This could be done in partnership with outreach staff who have relationships with individuals and able to identify people living in those areas and offering them the option of relocating in a shelter and or being connected with other services and housing supports. So I've had very, very preliminary conversations with the city manager. This seems to be in line with an approach that the city would be interested in taking on this issue. And certainly there would be many details that we would need to work out in this approach. And our partners at the Human Services Coalition and the Continuum of Care could provide that forum or act as a convening body to discuss this. And this would be a near-term model where we could maybe achieve some wins and address some immediate needs of those living in the encampments within the current system and the capacity and resources we have. And then with the county also taking steps in the longer term to develop a physical shelter and perhaps a more comprehensive low barrier approach in the years to come. There would be a cost to the county for this approach, and it would be greater than zero, but presumably less than 1.8 million that we estimate a full-blown approach would cost. And again, it's very conceptual and preliminary for discussion today to see if we should pursue it further to come up with some further plans and cost estimates and so forth.
So we'll take a pause there. I guess before we jump into the conversation, I do want to just say one thing, that the folks and individuals that work with this population that are trying to solve the challenges that face our community, I just want to make sure our appreciation and gratitude is expressed to them, because this is a very challenging problem that we have. I don't want to say problem, but there's a lot of things pulling in a lot of different directions, and there's mental health, there's substance, there's lack of resource, there's lack of space, there's so many things. It is such an uphill battle, and people who are willing to go every day to do this work, I think just deserve an immense amount of gratitude. And I hope through this process, we can potentially identify some areas where county resource potentially could be more supportive of that work to allow more transformative results. And you know, when we first had this conversation of Code Blue 365, it necessarily, the intent in my mind was not just sort of open the doors and business as usual, that it would have to be phased or modified in some way. So I do think that thought process is right on. I think we need to be open to try things and fail and or succeed, learn from those, retool, and continue forward. But I do believe that this is one of the greatest issues facing our community at the moment. And we need to make sure that not only are we providing shelter, but that we make it brief and temporary and one time, and that we also create a service-rich environment where individuals experiencing homelessness have the ability to be successful and come out of that. And there's a lot to do in that sentence, but this is the first piece and the first step. So I don't know if we're going to have a magic wand solution at the moment, but I think thinking in small bites, we can hopefully tackle this, you know, a little bit here and a little bit there, and it'll go a long way. So I'll open it up to members of the committee to respond to Lisa's comments, or if there's others, I know Liddy and Kit are on as well, if there's anything that they want to chime in and add. But members of the committee, any comments or questions? Ann?
Sure.
Oh, sorry, I thought you had your hand up.
No. I was thinking, so you probably heard the wheels going. So to me, if I have it summarized, what you said, Lisa, was that kind of take this money, not just take 1.8 million, but look at our resources, our financial resources, and also our staffing and all kinds of resources, and focus on trying to build something, you know, permanently. I'm not sure if that's what you said, or maybe that's where my head was going, but to focus on that. And although it's not ideal, you know, in a lot of ways, we'd like to have something like right now and ready for the spring and the summer. But with all the difficulties and challenges you're suggesting to us to, you know?
I'm saying let's try to do both simultaneously. That
Try and do both?
That we
Okay.
will, as we are developing in the longer term and the second part of this conversation, trying to develop an estimate for a shelter construction that will be larger and better able to meet the needs and some of the capacity issues. That's going to be a bit longer down the road, realizing that we have a very immediate need with homelessness and with individuals living in unsheltered homelessness and in the encampments, that we look at those areas in the encampments in conjunction with the city to see those areas where, and identified by the city, where individuals in unsanctioned areas are living, and coordinate efforts with the city to offer shelter to those individuals in a very targeted, coordinated way.
The specific population.
And kind of tackle it in a very coordinated and approach, and that we will be able to hopefully have the capacity to meet those needs, and with some success.
So just so it's a targeted approach to reduce the occupying of unsanctioned encampments, where we would reach out and find those that have a desire to get into a shelter type situation out of those areas and support them, or others from the encampment areas that really had a strong desire and willingness to participate in a shelter type situation, so that we could reduce the number that are staying outside in the encampments in unsanctioned areas throughout the summer months.
Yes.
That's the sort of the first step approach that is being recommended. Okay. Mike Sigler.
All right, I'll run through a bunch of stuff, I guess. It seems to me we have a shelter. It's not like we don't have one. So people do show up there, and if we're full, I could see us then maybe going to a different option. But this idea that we're going to go into the jungle or any of the encampments actually and start seeking out people to put them into shelter, I think that goes beyond our mandate, to be honest with you. I don't even, that goes to an enforcement model, I think, for me, and I don't think the county is going to be doing that. I frankly don't know how the city's going to enforce sanctioned versus unsanctioned now. It hasn't been very clear as to what it will do, right, in that case. Listen, $1.8 million is a lot. It's a lot for something we haven't budgeted for. I don't think it'll be that much because it's summertime and you're not going to get what you do in the winter. I have to say, too, that this is actually, we would almost be imposing a state mandate on ourselves if we were to take on this cost. I mean, the state clearly thinks that sheltering the homeless is a state, something the state should be paying for, because the state does pay us for it. They just don't pay us for it if it's warmer than 32 degrees without wind chill. So,
Well, just, I hate to cut you off. They do pay us for sheltering, but under very specific guidelines, requirements, and measures that we have to enact to get reimbursed for non-winter months sheltering. Under Code Blue, there's more of a low barrier approach with less restrictions and less barriers to shelter than other times when the state would reimburse us for. Is that a correct statement?
That's correct, yeah.
Okay.
so will we be applying those higher standards for this suggested program so that we get reimbursed by the state?
So the answer to that question, we have been trying to do some research and looking at other areas of the state that offer low barrier shelter. Namely, there's Onondaga County, and there's another model in Troy. And I believe in both of those instances, the screening is still done at the local Department of Social Services for eligibility. And if individuals are eligible for temporary housing assistance through the state, they apply and they go through that process and we receive that reimbursement. If they are not eligible, then that is the local cost.
And in our current system, right, come May 1st, if someone is not eligible, what happens?
I would have to ask Kit or Dina for that information.
Hi, everybody. Can you hear me?
Yes.
Okay. So if somebody is screened for shelter and they are not eligible, so currently, obviously during the cold winter months, we can put them, we can make them eligible under Code Blue because there are no requirements there. If somebody applies for what's called THA, temporary housing assistance, which allows us to shelter them, and they are found not eligible during the summer months, then we seek, we do everything we can to seek permanent housing for people. I mean, that's always the goal, really, when anybody comes in for shelter. So we have a number of different programs currently that we can sometimes help people with permanent housing. If somebody really is not eligible, they're over income, then it kind of depends. Sometimes there's, sometimes within THA people are eligible, but they have to make a shelter payment. So they have to contribute towards the cost of sheltering. Sometimes we have to look at what is this person's needs? Why are they applying for shelter? And do they really, you know, are they somebody who's receiving, for instance, SSI, and they might need to go into, you know, a single room occupancy kind of situation. So we do everything we can. You know, obviously we don't, when somebody's coming in to seek shelter, we don't just turn them away if they're not eligible. We look at what's going on for this person and how can we serve them. So I hope that's, it's very individual specific. I would say that the majority of people that are coming in seeking shelter qualify, and they're qualifying usually for a number of different social service programs, if that helps.
I just don't want people to think we're not doing this right now. We do this.
Oh, yeah, we absolutely do this. I think the point or the spark of the conversation is to try to do more of it and to expand the capacity beyond our 26 27-bed shelter we currently have. And then, other hotel space and things like that. But also to try to create the lower barriers to sheltering so that we can have an opportunity to work with these individuals and get them the other services and support that they may need during that time.
I guess my concern is, why do we have a centralized kind of thing? And it's because we want to provide more services to people. And the problem I think we're running into is twofold. We don't have some of these services. So it would seem to me if we were going to invest $1.8 million in something, which again, it won't be that, but let's take that as a number. Wouldn't it be better to invest that $1.8 million into something like the DTOP? Like, we don't have one of those. That's problematic to me. Like, if you're looking at one of the major things that our homeless population supposedly has, it's drug use and mental health. That may not be, I think that's the case. I mean, that's what I've always understood. Shouldn't we be kind of labor focused on that as opposed to this other end of things that the state has already said it is the state's responsibility? We're not going to be able to outspend the state, basically, is what I'm saying. The county's just simply not going to be able to keep up with the problem financially, so.
And I don't, Elisa, I'll let you respond.
I think my take on where we're at locally with the unsheltered encampments is it's a bit of a chicken and egg thing, in that the city is hard pressed to enforce individuals who are living in the encampments and the unsanctioned areas, or they're hard pressed to enforce a no camping zone there if there are restrictions on the shelter. If there's no place else for individuals to go, and that's where the county comes in. And if in the summertime months, if there are individuals who are sanctioned or otherwise unqualified, not qualified to receive THA housing in the shelter, they don't have anywhere else to go. So camping on public land, it becomes difficult to enforce the no camping on public land. So it's a bit of a chicken and egg. So if we offer it, then that will enable the city to enforce the no camping on public land. That's why the conversation or this coordinated effort would need to take place between the city and the county to make this work.
I mean, with all due respect, I've never heard the city say that, like ever, that they were going to enforce any type of no camping policy.
Well, we can be the chicken or the egg.
I think you need an answer from the city. I mean,
Well, I
the
think
city has literally never said that. They
Sure.
will not arrest anyone. They will not remove anyone.
Understand.
I don't really know where that's coming from, to be honest with you, because I've never heard that.
We also have never had the opportunity to have this conversation before. So I know that there was a court case recently out west, right, where essentially the prohibition on camping on public lands was not allowed if you did not have shelter space or shelter beds for those people to go into. So we need to create space. We know we have 27 beds is not enough, and I'm sure the next half of the conversation will validate that statement in some way. That's why we're having a conversation about building a larger facility with more services. So we also, as the county, in my opinion, have, if we have this as an alternative, there is a public health and environmental health concerns that have been expressed to us by our constituents. And part of that solution and part of working with the city to address some of those concerns is to get some of those unsanctioned areas cleaned up and to have a place outside of just a small green zone, but to provide shelter opportunities for those individuals so that they can receive the services in a more safe, more conducive environment to what ultimately is the next step, placing them in a more permanent supportive housing situation. So I don't know, and I'm not going to speak for or on behalf of the city, because that's not my role, but my feeling is the city's kind of in a hard spot right now, and I think we need to create a little bit of a path in the area in which we can affect, which is sheltering, for them to then step in and do the right thing around the sanctioned encampment areas and the unsanctioned encampment areas.
I feel like you're working on information that I don't have. That's how I feel right now.
What information do you need to feel better about this conversation?
I feel like you've had a conversation with someone at the city that I have not had, because this is literally not anything that I've heard from the city ever.
Okay, so I have Travis, Nels, if you'd like to come up to the mic, introduce yourself as a agent of the city.
It's been left to you, Nels.
Yeah, I did work with the city manager on some of the policy with the city, and they did adopt a protocol for responding to unsanctioned encampments. So basically, we've talked about what the city's going to do, but we haven't acted on it yet. And there is a protocol that calls for, with warning and notice, and attempts to get people into shelter. But if that fails, if they're in an unsanctioned area, the protocol says that the city will relocate their possessions. So there is a policy framework that the city manager is charged with operationalizing, and she's going to bring that to, I believe, the April 10th meeting of the Common Council to discuss her approach. So there is a framework to work from. Not that it won't modify or change over time. And again, just as Greg said, learning from attempts is part of the process. Every community who's dealt with this doesn't get it right the first time. But the city is trying to go with an approach that is sympathetic to the people who are vulnerable and out there in encampments, but also protecting the neighborhoods and the areas of the city that are impacted by those encampments. So I think we're at a point that's been described well here, that we're kind of at a point to want to go forward. The city has to also make a decision about, is it going to make improvements into the sanctioned area, which is called the exception zone now. And that's increasingly, as we learn, that that's an expensive process and doesn't necessarily, could be argued is not the best use of resources. It might be far better to use resources to work with the county to try to make sure people are housed, rather than some sort of a sanitary facilities out in the outdoors. So I think there is some framework to work from here.
Hey, Travis Brooks, and then Veronica Pillar.
I mean, the only thing I was going to say is, Mike, I'm not sure where you've been. The city, different folks from the city, the last few years, during tides, during so many conversations, members of the city said, we can't enforce this because there's nowhere for people to go. We would like to, but we don't have anywhere for people to go, and you can't do enforcement.
No way, man. That is so not what the city has said.
But Mike, you might have to pay attention a little more.
Really?
Yeah, really.
No, not really. They have said they will not arrest anyone. They will not forcibly
All right,
remove
well, hold on.
Come on, that's not true.
I want to be very cautious of the city says. I don't think the city or the county or the state or the federal government say anything till something's enacted. It still is passed, adopted, voted, if it's a policy, a piece of legislation, something like that. So what some individual members may say, again, is individual members' viewpoints. I have not seen an official document from the city that says something about that. And if I'm wrong or misspeaking, someone please correct me. But I want to be cautious about overgeneralizations and assumptions. Veronica.
Thanks, Greg. I don't know. I can't also pretend to know the city's plans, but I don't think arresting people helps anyone anyway. So I don't want to plan, I don't think it even helps us to plan around whether the city is going to send police to arrest people, because that either does nothing for where the people are residing, or you can throw people in jail, but jail is not housing. jail is generally hazardous to people's health, and jail is, as far as I know, paid for by the county. So if you're worried about county money, that's like also not helpful. I don't remember my other point quite. I'm glad we're talking about this because it does seem like, and already looking ahead at the like the memo Joan put together about number of folks that are unhoused and our tiny number of shelter beds, like when it comes down to it, the lack of housing is what causes homelessness. It's not mental illness or drug use or whatnot. Those things can be intertwined, but I mean, like I have a lot of resources gotten through various privilege that allows me to live in an apartment and keep that now. If that were taken away and I had to start from scratch, I don't know if I'd be able to get out of the shelter or into the shelter. It depends whether I have my cats. If I'm not making a lot of money right now, and so if I had to pay 75% of it to the shelter to stay in there, how am I gonna collect enough to get out? I don't know what my point, I guess my point is that many of the individuals we talk about are like not that different from you and me, like fundamentally, just in a different situation. And so the way like you all were thinking about this, which I realize is still general, seems promising and helpful. And I'm glad about that.
I want to restate the question that Lisa asked us. Would we as a committee like to see Lisa and all, Kit and everyone in concert with the folks from the Continuum of Care and other partners move forward in developing a more solidified recommendation that we could discuss and review. Obviously, we would engage city partners in that process to move forward to essentially expand shelter capacity on a temporary basis, and also look at what the potential cost would be to shelter individuals that may not qualify for reimbursable assistance to the county from the state. That's a fair question? I got it right again? Great. So I see Kit has her hand up, but then I want to go around and get a sense of committee members if that's the direction we'd like to go forward. And I just want to remind everybody, we've got 5 members of the committee. We don't all 5 have to agree, but I do think in the interest of time, we need to provide some clear direction to our colleagues and move on to the next item on the agenda, even though we could talk about this for the next probably 2 months. Like literally filling every minute for the next 2 months talking about this. Kit, I see your hand.
Thanks, Greg. There are 2 things that I just want to say. I think that in terms of providing the best services we can in the community to people, whether they are applying for THA, Code Blue, or whether they would be outside of either one of those programs, I think is something that is hopeful. What I would say that I would just kind of want to put out there are there's probably a million points, just like you said, we could probably talk about this extensively, and there's a lot to consider here in terms of how do we do this, how do we make it live, how do we keep people safe in shelter, and then how do we manage programs. But I will say 2 things that kind of stand out to me at the point that we're at in terms of thinking about things on kind of a quicker basis as opposed to a longer term planning process is, one, that we have had some pretty significant, as Lisa alluded to, we've had some pretty significant challenges with our Code Blue program this winter. So we've talked here about the size of our shelter, which is a 26-bed shelter. So the majority of the people that we have in shelter are in hotels. And currently, we are at about 214 people in shelter. So it's a big number, and there's a lot of people in those arrangements in hotels. And our hotel situation, in the primary hotel that we use, our hotel situation is, I will just say, not a tremendously solid situation right at the moment. So I would just, the thing I want to make sure that I put out there cautionarily is that I think that both in terms of our resources and staffing, we have had a very difficult time, not we DSS, but our partner has had a very difficult time maintaining staff over this winter. There have been a number of program challenges, and staff have not stuck through the winter. So there's been a tremendous effort at hiring. And as you know, as we all know right now, there's a real labor shortage, so that presents some real challenges. So in terms of kind of where we're at right now, it is a bit of a challenging situation. I'm not saying it's impossible, but it's challenging. The second thing that I would just caution people about is we can hope that as we try to reach out to people in the encampment, or as people in the community try to reach out to people in the encampment, the thing to remember is that social services is a service of voluntary application. So there is no way to say to people, you must apply. The county can set up a situation where they may want to say, if you want to go into low barrier, one of the things you first must do is apply at social services. But I think one of the things that is a challenge right now is that we've known for a while that many of the people that are in the encampment are saying they don't want to avail themselves of services. So I just want to make clear that those are two obstacles right now that could present challenges. They're not impossibilities. It's just that I think we have to consider those in our planning.
Deanna?
So I just kind of following up a little bit on what Kit said, I think another point that would need to be clarified. So it sounds like if you're moving to the Code Blue 365, that people currently in Code Blue, you would ask them to apply for THA. And if they weren't eligible, the county would pay. But then the question is how would you address it if people refuse to apply? So that's just another, I think, important thing for people to be considered in terms of implementation.
Sorry, I said Deanna. Dina, I apologize. I mispronounced your name. I appreciate those comments and Kit's, and I think one of the things, Lisa, that next steps would be is to try to address some of these more nuanced policy questions and come back with a clearly spelled out proposal for us to take a look at, recognizing that there are a lot of challenges and a lot of policy decisions that would need to be made in this process. So thoughts for Lisa? Ann?
Yeah, I agree with what you just said, Greg, and that I'd like to see, more information, come back. I don't know if we want to talk about it again after, because I know Joan has a lot of information for us. I don't know if you're going to review that or if that was just background, but I did read through all that information, so thank you for compiling all that. And regarding homeless stats. And so I would like to see some more information come back, including, which one of the big things we have to look at all the time is not the biggest priority, but a big priority as far as, what would it cost? And as Kit mentioned, what percentage of people do we think could get funding? Is it 60%, and help us flesh that out so we can figure out how to do that and where would we house these folks and do we have enough services to try and provide services for a majority of these people?
Veronica?
I think my answer to the fundamental question you're asking is yes. I think we should go in this direction, what the staff laid out. This isn't an actionable comment, but I wanted to throw in the comment that in terms of services, I know from folks who work with the chronically unhoused people that, and any kind of people, that relationships are really, really important in the support and services being successful, as in if you're out there providing services, which can mean a lot of things, it's gonna go, or responding to an emergency situation, it's gonna go a lot better if the people who you are attempting to help or respond to are people that you're already know and are familiar with and are buddies with maybe, or not, but you know their deal, you know their triggers, and that is something that is both valuable and probably not something that you can maybe you can put a dollar amount on it, but we talk about services, and I think that's just something to keep in mind, that can be something that costs the same can be wildly different in effectiveness. I see that a couple of people from our continuum of care are on here, and I assume they would be part of this partnership discussion, and I was just wondering if they had anything to say, if that's okay.
Sure.
Hi.
Hi, Liddy.
I have many things to say. I'm not going to say them because we're close to the end and other things. What I will say is that I and the continuum of care is happy to participate in future planning, pull together meetings, bring in folks from other places that are doing this work, and put in the data and stuff to figure out whether this is a viable idea or not. I think it is very much still at the concept stage right now. There's many barriers that exist in our current system, but I think that those barriers are not insurmountable, and it is worth, because the people that we're talking about still exist, whether they're in the shelter system or not. They are Tompkins County residents, and so we are interacting with them and serving them wherever, no matter what. So I don't know, I'm eager to be part of the conversation and happy to help how I can.
Thank you, Liddy. I guess I would look to Travis and Mike for any final comments on this topic or direction for Lisa and team.
I would support anything that created opportunities for people to have some sort of housing, allowed for people to be in a safe place, allowed for people to live in with some dignity. So, yeah, I would support anything that we could do to make a change in this direction.
Mike?
Listen, I don't want people to be homeless. I think I've made that clear. I'm supportive of the direction we're going for a full-time shelter as opposed to, housing people at a local hotel. And I've told people that it's going to be very expensive to do, but it's something that we have to do. But the fact of the matter is, we just simply don't have the resources for this. I mean, not put the money aside. I'm listening to our DSS person, and she's not against it either. But I'm listening to her going, staffing is an issue. Checking all the boxes off on why this is going to be. Is it impossible? No, I guess nothing's impossible. But I just don't see it. I'm not seeing it. I'm not seeing how you're getting 214 people, regardless of what you do at the local hotel. And particularly if we don't have the services available. I disagree. I think drugs and mental health are an enormous issue for a single person I've met in the jungle. I understand what you're saying, that there are people.
I didn't say they're not.
Okay, I've housed people, that have mental illness, and they're great when they're on their meds, and then they're feeling great, and they don't think they need their meds anymore, and they go off, and then it's a problem. And then we bring them back in, and then we get them on their meds again. And that is, everybody needs, it's not like, oh, services, you get them in, and they're treated, and it's done. I get that. I mean, and I just don't think we have the capacity to do this, unless the state were to come in and say, listen, we're on board with what your plan is. I just don't see this happening. So, yes, I don't want to put our county administrator onto a path that's away from what I think our ultimate goal is. I think that alone takes up a lot of energy to say, what direction should the county be in? Where should the county be in 2 years from now? And I don't want her staff going off of that target. So that's where I'm at with it.
So having heard from everybody, I think it's clear that we would like to have something more detailed, more fleshed out. I would say that for me, I view this a little bit of a test case of some of the policy questions that we're going to face if we want to have a low barrier shelter at some point, or what kind of shelter we want to have as we look to expand our shelter system. Are we just going to go with what the state recommends, what the state will reimburse? Or are we going to go a step further? What services are we going to provide? How do we create services that are attractive and irresistible? And I understand that that takes resource and service providers. But if we can't do it now at a small scale, what's going to happen when we have additional shelter capacity at a much larger scale? So this, I really do feel, is a natural, logical line of order to pull the pieces together to find out where the kinks are in the system, but also we at a state level need to be advocating the heck out of our elected officials to change many of the antiquated and inefficient and significant barriers that exist to just getting people in the door for reimbursement. So yes, there is a lot of work to do at every level of government around this issue, but I think we have to take some sort of step to figure out how we do this, because if we think that we're just going to at some point build a building and open the doors and not have policy decisions that we need to make, we're wildly off base. And I think this gives us the opportunity to start working through those issues sooner in parallel tracks to put the potential of looking at a larger, more expansive shelter facility, permanent supportive housing, temporary supportive housing, all of the rungs of the ladder that need to exist for an effective system to be part of our community. So, Lisa, we look forward to the next discussion. We're going to change gears now, and I'm going to turn it over to Katie. I just want to do a time check for everybody. It is 4:31, but...
And just a reminder, I have to leave at 4:45.
And Ann does have to leave.
And I know we have a couple resolutions.
We just have one other resolution remaining.
No, I mean that, but
So
Sure.
Katie and then Joan, also appreciate your time and effort and energy on this as well.
Great, thanks. Early in 2024, Lisa called and asked whether our department could take a look at the data around homelessness. And I said, yeah, I think that our staff have the skills that could take a kind of a fresh systemic look at the issue, not being so deep in the weeds as a lot of our partners, and just kind of pull back and look at what the data and what is and what the data might be telling us. So we pulled together a group of people, including Liddy and Dina and Kit and Nels and Lisa Nicholas from the city, and had really, I must say, a great partnership, all diving into the data that was available to see what was the best information we could pull together to share with the legislature to inform your decision-making around emergency shelter. So I asked Joan to head it up in our department. She's the math whiz in the department, and so she's going to walk us through the memo.
Yes, thank you, Katie. So I want to preface this by saying this is purposefully entitled preliminary report because you may have follow-up questions that are raised by this that we might need to do some digging in, but I didn't want to just overwhelm you with 1,000 pages of stuff. If you have targeted questions, we can try to dig through the data to get answers to those specific questions. But just to give you a quick overview, I'm going to assume you've read in rapt attention every word of the memo, but just to give you a little quick overview and to the members of the public who may be watching who have not read the report. This report is largely based on what happened in fiscal year 2023. During that time, the emergency shelters system in Tompkins County served 597 individuals in 477 households, which gives you an average at any time of 132 individuals, but it ranges widely throughout the year. So we try to look at meeting needs during some of the higher points of the year. So we took as a starting place, what would we need, how many people, how much emergency shelter space would we need in order to meet the full needs of persons who are experiencing homelessness for all but 6 weeks of the year. Following a sort of a concept of you don't build to meet the absolute top number you would need to meet. If we did that, we'd have vacant beds a lot of the time. So we just pulled a number, which we can adjust if people want to look at those figures differently. So to meet that idea of all but 6 weeks of the year, that would have meant accommodating 133 households that included 186 people. And of those 133 households, 11 would contain children. We also did a little breakdown on some categories of households or persons that the county might want to serve separately or in a different way. For example, like youth households or households with adults that have mental health disorders. So we provided sort of a supplementary table on that. But if we were trying to meet all those separate needs simultaneously, we would need to build a bigger facility because you wouldn't always have the exact same percentage of each subpopulation all the time. So you'd have to build a little bit bigger. We estimated, now we're getting to more estimates than actual data, that would be only 3 more households, but there would be 241 individuals rather than 186 individuals. And again, not a large increase in the number of households with children, but going from 11 to 14. The report also includes just a little information on other segments of the homeless response system, not just the emergency shelter part. I'm not going to go over that. I'm just going to stop and happy to try to answer any questions you have or to encourage you to shoot me an email or give me a call to say, I like what you provided, but could you look at this little piece that you didn't happen to include in your report? So I'll stop there and see what y'all have to say.
Open it up for Lisa first.
And just to also provide us with more context that this, at some point in the near future, as we move toward construction for a shelter, we're going to need to put some specifics into an RFP about how big a shelter we're going to be building for how many people, and we're just really trying to pinpoint what we need. And there are a lot of nuances that Joan was alluding to in that not everyone can be sheltered under the same roof. So it probably will not, we still will likely need to rely to some, hopefully much lesser extent, on our private partners in the community.
Questions? Ann.
doesn't need to be answered right now, and I don't know if it's a question or just a thought that I think it's come up before, but thinking about as much flex spaces that we can put into whatever we build so that we're not kind of putting ourselves in a corner that we have 50 beds for this, but there's only 20 of them filled and we have overcapacity in another population. So again, I'm sure that's probably something you're thinking or something just to remind us all to keep in mind as we go forward, because I know for other facilities that house people, I know that's an issue. It's really difficult, if not impossible, to do that after the fact.
Other questions or comments on the data? Veronica?
Thank you for this. I found this super helpful and easy to read. I have a question on the page, like the last, not the appendix, but the page before that, back up page 18, where you're talking about households that exited transitional housing, rapid rehousing, permanent supportive housing, and emergency shelter. And you've got the proportions of households that found permanent market rate housing outside the homeless response system. I guess that part makes sense, but in the detailed notes for the transitional rapid rehousing and permanent supportive housing, I think I understand what it means to be in transitional housing and then find permanent housing. But I don't really understand for the rapid rehousing and permanent supportive housing, what finding housing outside the system means in those contexts.
Yes. Oh, good, Liddy's here. She's much better to answer this question than I am. Thank you, Liddy.
Liddy, take it away.
Yes. Hi. So that is, I mean, that's a confusing question, detail, nuance. It's a nuance, but basically it would be, that's a system performance measure, a HUD system performance measure, I could tell that you just read. And people that would be people who either retain their permanent supportive housing site successfully or exit to housing in the market, regular rental or owned housing. Does that answer your question?
I think for the permanent supportive housing, yeah. So if it says that 25 houses.
And then rapid rehousing is the same thing in that it has, rapid rehousing, it is a time-limited program. So at the time that they're exiting, are they able to maintain the permanent housing that they moved into, their housing move-in date was in that housing, or new permanent housing with a move-in date?
So for rapid rehousing, 65%, the finding permanent housing outside the system might mean just continuing to live in the housing that they found in the system, just now they're no longer connected to the rapid rehousing.
It's not being paid for with money that came through the system.
Okay, thank you.
Other questions? Well, Joan, you've done it. You got them to all be quiet for a little bit, myself included, so I appreciate it.
I think for the fact that it's 2 hours since you started, it was on my side on that, that observation.
I will make sure that this is shared with, and if you could maybe send to us, or we can share out with the rest of the legislature, this information or this memo that you put together.
You can do that. If you want me to give you a couple of days in case there was something further you wanted me to dig into, then I can put that in the memo and share it broader.
Yeah, that's great. Why don't we'll give members of the committee maybe to the end of the week.
Okay.
So that early next week, Joan, if you could share that with all of us, and I'll make sure to share that with members of the legislature.
Be fully prepared that that the answer to your question can't be done.
Sure.
Great,
sure.
Thank you.
That's fair. I appreciate pulling this information together, and again, it's just a starting piece for us to be able to work from. So I know it may seem like 10 minutes in the spotlight, but it was much more work leading up to that, so thank you.
And it helped inform our other discussions.
Which means I have to give great thanks to everybody at DSS and Continuum of Care who helped me untangle and start to understand the data.
Great. Well, thank you for doing so. I will move us on now to, we have Ithaca Area Economic Development. There's a resolution. Heather McDaniel, IAED President, let me know that she was going to be unavailable, and we had a chance to connect beforehand. But I'm going to go ahead and move this resolution onto the floor. And then I'm going to read the resolution of the Tompkins County Legislature as the elected body of Tompkins County, New York.
Second, Doug.
What?
Second.
No, I'm just reading the title. I'm just reading the title. But Ann Corman's going to second the resolution. She hasn't let me know. I'll start over. Resolution of the Tompkins County Legislature as the elected legislative body of Tompkins County, New York, in accordance with Section 147F of the Internal Revenue Code of 1986, as amended, the code, approving the issuance by the Tompkins County Development Corporation of its tax-exempt and/or taxable revenue bonds, Cayuga Medical Center at Ithaca, Inc. project, Series 2024 in one or more series as part of a plan of financing in a maximum aggregate principal amount not to exceed $8,350,000 for the benefit of Cayuga Medical Center of Ithaca, ID number 12326. I move that and seconds that. Wow, and that title really cleared the chambers. That was the longest resolution title. This essentially is procedural in nature, does not have a financial impact on the county directly. This does not impact the county's bond rating in any way. And if there's other questions, I'd be happy to answer those, but this, to my knowledge, is largely a procedural piece of what we do with the Tompkins County Development Corporation.
Can you remind us what the Tompkins County Development Corporation even is and how it's related to IAED and also to Tompkins County?
Lisa, is that
Because
something?
that title was not clear.
Because I'm joking.
Oh, dear. This is one of the quizzes that I fail at. I don't know that I'm the best person to answer that question. It's an arm of IAED, but I'm sorry.
And they help facilitate organizations getting bonds or loans, often through New York State, and they're a conduit to help them, if that kind of concisely puts it.
Correct, yes. So they're I can't say it better than Ann, so.
Okay, great. I guess there's no, effect on the county much on
No.
approving this or not. I have a lot of questions about it that I won't ask now because there's no one from IAED or TCAD or Cayuga Medical Center here.
If you'd like to follow up with those questions, if we move this out of committee onto the legislature, and you want to send me those those questions, I'm happy to follow up with Heather McDaniel, and then also the legal counsel for the Tompkins County Development Corporation has also made themselves available to answer any questions that may arise.
And we have a meeting on next Wednesday at 2, the IDA and the
IAED.
IAED.
Yeah.
Right, where we could answer those questions at that board if you want.
The IDA or the IAED board?
IAED, well, not the IDA, the Tompkins County
Development Corporation?
Development Corporation, we could address that there. Because we have,
Okay, great. Thank you.
both meetings, like one right after another, at 2 o'clock next Wednesday.
So if you give me those questions, I'll make sure we get an answer.
I will do that.
All those in favor of moving this resolution on to the full legislature? Okay, That passes. The next one we have is a workforce development, I'm going to read the resolution title, Workforce Development and New York State Department of Labor 2024 Ancillary Agreement ID 12299. I'll go ahead and move that if I could have a second. Seconded by Veronica. This, to my understanding, is a resolution that highlights their space needs and the additional agreement relationship with New York State. Is that correct, Lisa?
Yes, I'm trying to get to there in my
packet. Page 107.
Yes, this is the, for the Career Center that's currently in Center Ithaca. And this is, we pay rent there through, and the Department of Labor is the leaseholder, so we pay through the Department of Labor.
Got it. Any questions on this resolution? All right, seeing none, all those in favor? All right, that passes unanimously. I will go back up to my, any reports from members of the committee? Okay.
Just wanted to remind folks for the chambers inviting us to attend an open house at Borg Warner in a couple weeks.
Yep, I'll make sure we circulate that information to members of the legislature as a reminder. Any other committee member reports? All right, seeing none, is there a motion to adjourn? All right, it looks like everybody's moved. I guess I'll second it since Veronica moved it. All those in favor of adjourning? Great. Have a great day, everybody. It's 4:49.